I was amazed at the amount of medication some people were taking. I mean, to say that they're taking 20 different meds a week is not unusual.
The average person has 8 to 10 meds at our pharmacy, so just trying to negotiate those different medications is very difficult for them.
They may not understand why they're taking all of these medications, what they do, what the effects are.
Also, some of the complex medications just by themselves are really difficult to manage for anybody, such as the medications that you have to take multiple times a day, certain number of hours apart. This one's without food, this one's with food. That kind of regimen can get really complicated very quickly.
We deal with patients that often are highly stressed, have lower health literacy, don't always have appropriate caregiving support.
Everybody needs help in some degree. Some people it's kind of a low level, other people it's more extreme, but everybody needs help. I've run across members that are using expired medications, that are taking duplicate medications.
The pills look alike, the dosages seem similar, the names of the medication seem similar. So it seems what is clear to us for them is often like speaking a different language.
Getting an accurate medication reconciliation can be extremely difficult. It relies on a lot of different pieces. We have our medical record, we have records from other facilities if they were hospitalized or if they were in a nursing home or assisted living.
So it's a very dynamic situation where you might say it's just ripe for error and ripe for complication. The medication organization tools that I have seen in the past have focused on the healthcare provider side, using dosing schedules written out in multiple ways, multiple locations, the identification of the different medications by picture, but I'm not sure those are truly the types of strategies that really achieve a high level of understanding in the way, and especially in the context of low health literacy.
The MyEasy drug system, also known as the MEDS chart, allows patients to tell their story about their medication experience. First, what do they know about their medication? Patients can write down the name and strength of their medications. Second, why are they taking it? What condition are they using it for? Third, how much and how often are they taking it? Fourth, how do they feel about their medication? By filling out the MEDS chart, patients and those who care for them get a clear picture of what is actually happening and how they feel about it.
I think what it is it's an interview tool, and I think by asking the right questions, you're going to run across information that you weren't expecting to get that's going to be really beneficial.
What surprised me is that this program hasn't been done before. Someone hasn't come up with it before. It's so easy.
Oftentimes when I see very complex tools, it seems to be implicit in them that they would replace the relationship between the provider and the patient or somehow take over some of that work. And I've just never seen that to be effective. In other words, there's parts of the relationship that are not about information. They're about motivation, about support, about empathy, a series of human elements that will always be there, and so the tool needs to support that work. And that's why I see seemingly simple tools like MEDS being the most effective.
This is such an easy-to-use tool. It is so profound yet simple in its design.
So there's a smiley face, there's an unhappy face, and there's kind of an indifferent face. And so each time that we talk to a member about their medications, we ask them, how does that medication make you feel? And at the very end, I look through all the ones that make them feel unhappy, and we can go through all of those, and then we can act on the things that are bothering them.
I find that when they're able to tell me how they feel about their medication, they feel empowered. They have a voice in their medications, that they have a voice about their health.
The more discussion there is regarding their diagnosis, the medications, the more the patient's going to learn about themselves and learn about their disease state.
They can ask me, why are you prescribing me that medication? Or what is that for? Or why did we change that today?
Whenever I have any questions about medications or anything like that, I go to my pharmacist. And if I have this chart, I can go to my pharmacist that fills my medications. I can say, look, this is what I'm taking, this is what's going on.
It does help bridge that gap between, you might say, the expertise of the provider and the experience of the patient. It's really a collaboration.
Maybe instead of always having a bad day because you haven't taken your meds right, you start having good days and start smiling and says, wait a minute, I'll have another good day. You get greedy when you get older. You like these good days.
I'm telling you, I've seen the difference that this program's making. It boosts morale, and not only that, when these people see they have more control of their life, and this gives you more control, more say, and it gives you another way of communicating.